Hari Om, Shri Gurubhyo Namaha, Om Dhanvantaraye Namaha. In the last video, I talked about male infertility. So, this video is going to be about female infertility. In my Bharat Clinic and Viva Ayurvedic Center, we treat a lot of male and female infertility cases. This is more or less like our mainstay. So, when we say female infertility or female subfertility, there are many reasons which can come into play. That is, the uterine factors. The uterus can have some problems, or the ovarian factors where the ovary can have some problems, or cervical problems. The cervix can have problems, other hormonal deficiencies, or too much overaction of the same hormones. Other than this, there can be other fallopian tube blocks, that is, tubal causes can be there, and many other causes like this. So, the most commonly seen problem in women in fertile age is PCOD or PCOS, polycystic ovarian syndrome. This is a PCOS is a conglomeration of many problems. So some hormones go in surge mode, some hormones become deficient, and basically, the lady has many follicles in the periphery of the ovary and none of them mature. Usually, normally, what has to happen is two or three follicles maximum will come, which will start getting matured, and one of those follicles will get matured and it will come out for fertilization. When this fertilization does not happen, the follicle turns into a Graafian follicle and then corpus luteum, and it triggers the next menstrual cycle. So, because this follicle does not get matured, there is no triggering of the next menstrual cycle. Many ladies also come with an associated problem of amenorrhea or secondary amenorrhea. Amenorrhea meaning not regular menstruation is not there. A secondary amenorrhea is when a girl or a lady has started to have regular menses after her puberty, and because of some or the other reason, it gets ceased for more than 6 months. So PCOD is talked about as a very, very big problem, and many in modern biomedicine, that is in allopathy, many treatments are given for this. Even IUIs, IVFs, when they are given, uh, medicines are given for maturing, making the follicle matured, and then for rupturing the follicle, separate injections are given. Many other medicines are also given. So these have a lot of side effects, as we know. So Ayurveda has a lot of superb medicines, I should say, for curing PCOD, and this happens very fast also. It is not a very time taking process actually. In PCOD, whenever a person comes to us, initially we give them a Virechanam. A Virechanam is a medicine induced loose motion therapy. That is, first it clears the toxins from the pelvis. The same procedure is also given when you want to clear some fallopian tube blocks. This is a preliminary procedure. After this, there are many procedures. Other than this, medicines are also given to clear fallopian tube blocks, to clear PCOD, and other secondary amenorrhea problems, and all that. The longer the problem is, the long standing, the more chronic the problem is, the tougher the treatment is. This is a natural thing that is there in treatments. So, when there is PCOD, I initially go with Virechanam, and then there are umpteen number of medicines that we can select from, and a specialized, highly tailor-made combination is made for each and every person, and we cure PCOD somewhere within 2 or 3 cycles maximum, and then there is very, very regular menstrual cycle. Overcoming secondary amenorrhea is actually a little bit tougher when the lady has not had a menstrual cycle for the past 6 months or more. Overcoming that is a little bit difficult. So we go with Virechanam, internal medicines, that is oral route medicines. We also give some Utravastis, specialized Utravastis, and Matravastis. And these treatments trigger the next round of menstrual cycle. Sometimes the endometrial layer is very thin. Those things can also be addressed very easily here with Utravastis and Vastis and internal medicines. There can be some cervical causes, like how I told you. There can be other polyps and all that. Those can also be addressed. Basically, we also ask the lady to make sure that she doesn't have any constipation, because constipation is a deterrent when it comes to fertility. That is the practical thing that we are seeing. We call it Apanavayusthana, and there's a pelvis, and in and around the pelvis, all the organs put together, we call it as Apanavayusthana, and it has to be kept clean. So, a normal bowel movement is always very good. Other than these specialized treatments, we also give diet advices, exercises, yoga advices, and in some cases, we also use acupuncture, acupressure. So, we are a team of doctors who take into consideration the holistic approach, and PCOD is very much curable. Thank you.